Huh?
Whenever they're...
Yeah, what's up?
We're waiting. Good? All right. Peace and blessings, everybody. Love and light to you all. Obviously, you know by now we've just come from a unannounced tour of Rikers Island. I think all of us have been there a few times in the past year. The first thing I do want to mention is when I came here a year ago, it was simply atrocious. It looked like a jail that was on the brink of simple disaster. And so I do want to say, while I think it's still not the safest place to be for anyone who's housed or worked there, I do want to just say it is demonstrably better than when we were here a year ago. The intake system is operating. People seem to be moving forward. We did see folks who were in what was previously considered a solitary, now outside a lot more, getting programs. They described it as being in much better conditions, feeling in better conditions, seeming to try to at least follow some of the spirit of what folks wanted in the halt solitary. When I was here a year ago, there were corrections officers working triples, even quadruple shifts. Most officers I spoke to are now down to doubles, which is much better than where we were. And so I do want to just say I'm thankful that what I saw a year ago is demonstrably different than what I saw, and I'm sure my colleagues will say we saw today. There are some things that still need to be better. One, while I'm happy that the corrections officer no longer working triples and quadruples, doubles seem to be the new shift. And we do want to make sure that if folks are volunteering, it's one thing, but we do want to make sure that people are getting the rest that they've gotten. Most folks say they can get up to 8 or 10 hours in between doubles, but if they're there, they're going to be doing a double. We want to make sure we can try to lower that while keeping the staffing that we need at a good level. Some of the officers are still complaining about not being able to get meals, so we do want to see that change as well. We did see a number of people who were complaining about not being able to get their medication, which is a concern. Some folks are still not being able to get their medication, so we want to see that change as well. One of the bigger things that we have seen because of COVID and other reasons, there's just a widening time period that people are waiting on Rikers. And we know folks are a lot focused on bail, which is something that has not been proven at all to be what we should be focused on. I do think we have to focus a lot on just getting people's trials done, get them adjudicated, so they either go home or they go upstate. But to see people sitting on Rikers Island just waiting makes no sense, doesn't help anyone at all. Everybody I agreed that most people should not be on Rikers. It was said that 60% of the folks coming in have some kind of mental health condition. We did see places on Rikers that seem to be doing the best they can to provide medical care, but that is not a place that people should be having medical care. Lastly, myself and the council member have a bill to try to end solitary. I did see a lot less people than what was previously called RAMS that a lot of people had concern about. There were a lot less people there, which is good, but there still were some people. And we still think our bill needs to move forward to make sure we can concretize and describe the experiences that people are going through. So in summation, it's a lot better than what we saw. It's still not where it needs to be, and there's a lot more work that needs to be done to make sure that everybody's safe on both sides of those bars. And I'll tell you again, like I always say, on both sides of those bars are mostly black and brown folks coming from communities, and corrections are mostly women. And I feel if the population was a little bit different on both of those sides, we probably wouldn't be having this conversation. So next up I'll call the comptroller.
Let's, in the spirit of it mostly being people of color and women, have Carlina go next, although I want us to note whoever's this is, your memory is full. So I don't know if you want to delete it or...
So next up we will have the chair, Council Member Carlina Rivera.
Thank you very much for being here, everyone. Unannounced visits like this are critical to ensuring transparency.
We're doing the presser on mufflers next.
Again, unannounced visits like this are critical to ensuring transparency from the Department of Corrections. So we were here with a few things in mind to certainly speak to corrections officers, to get an idea of what the culture and the environment is among the staff, but of course to speak to the detained and the incarcerated. Immediately upon arrival, we did notice improvements, and the public advocate did speak a little bit on what we've seen that has improved. I will tell you that one of the first conversations we had was with the corrections officer, who said very, very plainly that nobody is showing up to work, that they are forced to work double shifts at the very least because there are not enough officers coming to work, and the conditions there remain unsafe and harmful to both officers and the incarcerated alike. Some of the conversations that we have had are on missed medical appointments, certain people inside incarcerated not receiving their medication, waiting for a trial date, asking for more recreational time. And yes, there is a pattern of who is inside of Rikers Island, predominantly black and brown people. And I'm sure upon reviewing the data, they are from specific zip codes, especially in this city. Black, brown, low-income immigrant parts of Brooklyn, Manhattan, across the 5 boroughs. But it is consistent as to who is incarcerated and detained and who certainly needs the supportive services that we notice the department is trying to get to be more consistent. We spoke to a gentleman that said they have spent more time in Rikers Island than they have in the streets of their own neighborhood of Brownsville. We met 2 babies, a 1-month-old and a 3-month-old. Babies are being born and raised inside of Rikers Island. In addition to that, we have to address the staffing crisis and more programming, these systemic inequities inside of this system as who is incarcerated and detained, it must be addressed. What we saw in terms of certain individuals inhabiting very, very small spaces, that to me does not define true rehabilitation. So we have the staff who gave us a lot of time, who answered many of our questions, and we certainly will pursue further action with another hearing inside of the City Council to fulfill my own charter-mandated responsibility of oversight and investigation, and to hear the bill to finally ban solitary confinement once and for all as soon as possible. So of course I want to thank the people that do show up for work here. I understand there is a lot for us to do in terms of the 15 people who identify as transgender people, ensuring that they also feel safe in their surroundings and are receiving services. And whether it's workforce development, whether it's educational services, one young man said he took a parenting class. We have to ensure that we are working with organizations that we have met, who we know provide consistent, reliable programming, and that remains ongoing. So with that, I will turn it over to our comptroller to go over a bit of what we discussed. Thank you.
Thank you so much, Carlina and Jumani, for organizing together this visit this morning. As some of you know, last week we put up a new Department of Correction dashboard to try to put up some of the data that helps us understand what's going on here. But transparency requires more than charts and graphs. There's just critical things that you can't know if you don't come see it for yourself, and I appreciate the opportunity to do that together. One of the things those charts showed was a trend on staffing, which on the one hand is better than it was in January for sure, but still double the absences of the pre-pandemic. So before the pandemic, about 5 or 6% of correction officers were out sick on any given day. It got as high as 20%. And the numbers that we put up last week showed at about 12%. So down significantly from January, but again, still double the pre-pandemic numbers. And I think this really speaks to what both the public advocate and the chair were saying compared to when I was here a year ago. Oh my goodness. The intake at that moment when it was in OBCC, people were there days and days, sleeping on the floor in the showers. Now we understand for the most part, people are being processed in the 24 hours that they have. And I talked to the warden at GRVC who said she's only been there 3 weeks. When she got there, they were getting a 0 out of 4 for producing people for their clinics and medical appointments, but she's already got it to 1 out of 4. She's confident it's going to be 2 out of 4 next week. And you could see that progress, but that still means an awful lot of people aren't getting to their medical appointments, are getting to their clinics. So we have to keep pushing on that work. I'll just tell you a couple other stories. So I do want to agree with both the public advocate and with Councilmember Rivera compared to the last time I was here, meaningful progress. At the same time, I'll tell you a few stories of things I saw that nobody could feel okay with. So we spoke to one gentleman who's been 24 hours in a holding cell about as big as the area the three of us are in, with no bed or cot and no blanket. He's been determined to need a mental observation unit. There are no mental observation units available right now. So in that facility, there's 37 people waiting. And at least for this one that I talked to, 48 hours in a holding cell without a bed or a blanket. We got to do better there. Both Jumani and Carlina alluded to this, but ESH, the significant number of people, we understand there are about 100 people in the GRVC, in the facility that we saw in ESH. That's the code name for the thing that we once called solitary. That halt solitary was designed to change. And the department has indicated that they're complying with the spirit of the RMAS system, even though the monitor suspended the deadline for it. And those people reported, everybody that we talked to, that they are getting their 7 hours at least out of cell time, some 10 hours out of cell time, with some programming. There were puzzles and some art therapy. So for that significant set of people, it looks like there's meaningful compliance. Now, I will say that we did at the end see 7 individuals who are in involuntary protective custody. And boy, that looks like what you imagine when you think of as solitary. That's, there's kind of a 2-part cell, each about as big as these squares we're on. One with the bed, and then what counts as getting out of your cell is that you go into this other little area, but they're each as dark as night. You have nobody else nearby, and the folks we talked to were in those units 22 or 23 hours a day without meaningful engagement or human contact with others. Again, only 7 individuals that were in that setting. But boy, from my perspective, the HALT law was designed to prevent that kind of condition, and we did still see it. I talked to a woman who has been there a year for stealing a coat and gloves. I talked to a man who's been 8 years at Rikers awaiting trial on a murder 2 charge. But had he pled on a murder 2 charge 8 years ago, he would long have been out. And because he's contesting his innocence and awaiting his trial, his fair day in court, he spent 8 years on Rikers Island, a whole bunch of them in the infirmary. And boy, the infirmary is not a place you would want to send a sick person if they were related to you. And I'll just end with what Jumani sort of said and observed. And striking to me that at Rosie's, we went to the women's facility, the women's and transgender. And the warden more or less acknowledged that the vast majority of people there, they don't belong in jail. Yes, some of them need drug treatment. Yes, some of them need supports in their communities. But little to nothing is being gained, and much is being lost, both in our tax dollars and in their lives, by having people await their trial in jail when they don't need to be. So that's what we saw. We're going to continue to keep updating the data on the dashboard site monthly as we get it from DOC. And I know all 3 of us have been here before raising voices, and we'll be here again.
We got there probably about 9 until now. We got maybe 4 different housing units.
We visited 4 facilities.
Every unit I went to, I made sure to speak to several people who were incarcerated there, and made sure I spoke to people who were working there, whether it was COs and some of them were medical staff. Wanted to get a feeling of how things were and how people were feeling.
And one thing I just do want to point out, so I think it's about 5,700 people today in the city jails, mostly on Rikers. More than half of them with some mental health or mental illness diagnosis. We actually did not go to AMKC, the facility that's got about 2,000 people, overwhelmingly people who are, under observation for mental health care. People who need mental health care, not a jail facility.
So, people who are not getting their meds, is that because of the guard shortage?
Primarily staffing. Staffing is still an issue in terms of meds and appointments. We did hear a couple folks saying they weren't getting their rec as much as they should, so we want to try to look into that. But I think the predominant complaint we heard was medication.
Couple of questions. Given you all had some positive remarks about improvement on Rikers, under those circumstances, do you think that the federal takeover should still happen? I know you've all expressed, I think, support for that. And two, the solitary bill, the councilwoman, I guess you're a co-sponsor too, right? The fate of that, if you're having, when is the hearing, and is the speaker, I know she's expressed some support for it, but do you expect that to actually move forward and pass?
I haven't expressed support for federal takeover as a moment, and I actually have said, having seen MDC, I'm a little bit concerned because they have some of the similar problems. But I don't think anything's off the table. This is one visit. As unannounced as you try to get, you sometimes can get what folks want you to see. I will say they didn't deny us from going in any place, so that's good as well. As atrocious as it was in September, I would hope you can only go up from there. But there are some concerns. I still think that I don't think anybody